All right. So here, guys, we're actually talk about some aspects of deep vein thrombosis. So these are the risk factors, like what will make you to have a deep vein thrombosis. Okay. So risk factors. We have to talk about clinical features. We have to talk about lab findings. We have to talk about treatments for deep vein thrombosis. Okay. So for the risk factors, what will make you predisposed to having a deep vein thrombosis? So inevitable stroke your environment. If you're advancing in age, that's like inevitable is something you cannot do anything about. Advancing in age, pregnancy, prolonged immobility, that means you have traveled for a very long time, or bedridden patients, you have been on the bed for a very long time, obesity, if you're obese, trauma, the iatrogenic, that's basically caused by some medical procedures, right? So surgery, side effects of some surgeries, indwelling device, okay, all those catheter implants, hormone replacement therapy. There's sometimes if you're undergoing some therapies that involves you getting some mad ass drugs like the chemotherapy, this is deep vein thrombosis, see that on the leg. So sometimes the cause risk factors, disease related. It could be that you have cancer, it could be that you have antiphospholipid syndrome, it could be that you have myeloproliferative disease, it could be that you have sickle cell and other sickling syndromes. Right. Then what's the clinical presentation? That's the next part of the question. As the signs and symptoms, right? So patients that have this usually have swollen legs, all right? Their legs are warm to touch and they are discolored. You can see that this leg is bluish, okay? Then pitting edema, presence of collateral superficial non-varicose veins, okay? Then diagnosis just involves clinical prediction using the Wells score from history and physical examination. All right, you can also do the D-dimer testing. All right, so if the D-dimer is actually high, okay, the imaging studies is compression ultrasound scan is with color Doppler is actually the diagnostic. This is R is diagnostic imaging here, you understand. But other imaging techniques can use contrast venography, then magnetic resonance imaging. Okay. Treatment goal is to prevent extension and reoccurrence, also to prevent what post-thrombotic syndrome and chronic thromboembolic hypertension. Now, treatment properly now, you can involve pharmacological options. You can give anticoagulants like warfarin and heparin. You can give what thrombolytics like fibrinolytics, okay, like streptokinase, urokinase. Then that's basically the pharmacological aspect of it. Non-pharmacological one is graduated compression stockings, intermittent pneumatic device, inferior vena cava filters.